In our previous videos, we have discussed about female hair loss, the causes of hair loss, and different treatment options which are available to treat it. In this video, we are going to discuss in details about female hair transplant. What are types of hair transplants? What are different indications of hair transplants in females? And what are the challenges which we face when we do a transplant in females? So if you haven't already subscribed our channel, please do it right away. And don't forget to press the bell icon to receive all the notifications. I'm your friend Dr. Shail Gupta, and I have been practicing hair transplantation for past 17 years. As we have discussed, hair loss is a very common problem in females as well, and it becomes more challenging in females because there is less social acceptance for female hair loss. It is still okay to an extent in a male patient. So, we have discussed about the medical treatments in length in our previous videos. The links are given there in description. The biggest challenge which we face when we are doing hair transplant surgery in females is we cannot shave off their head as we do generally in male patients. So the transplant has to be done in the existing hair, like we don't cut them, we don't shave off them, we just put grafts in between. So this is challenging. It requires skill, it requires experience, and we have been doing it for many years now. So only a skillful surgeon can do this, which is a kind of difficult job. Now, different patterns of hair loss are seen in females. One pattern is which is the commonest one, is female pattern baldness, where there is thinning in the middle portion. Now, the problem which we generally face in such patients, the donor area usually is very thin in these patients as compared to other indications of female hair transplant. So there are very thin hair, and the density at the back of your head is also less. So there are two methods, FUT and FUE. In most of such cases, we have to combine FUT and FUE to get most optimal result. In some patients, however, if the donor area at back of head is not sufficient, we can take hair from body as well. Like we take pubic hair, we take axillary hair. They are good source, and the hair are curly and little thicker also, so it gives a good camouflage. uh, as you can see in this patient, she had thinning in the middle. We did a transplant without shaving off her head. You can see some post-op pictures. Usually the swelling subsides in a few days, and then there is a scab formation, but patient can part her hair from the sides, and she can easily hide it, so the social downtime is minimized. And then if you see, there is a falling phase. These hair fall, and usually it persists for 2 to 3 months, and then there is regrowth of hair. These hair then grow at a rate of 1 centimeter per month approximately, and then it keeps growing. So it will take some time for these hair to grow in length, but usually by the end of 4 to 5 months you have an effective coverage because of these small hair, and obviously they will grow later. So another pattern of hair loss which is seen in females is male pattern, where there is hair loss from the sides. So if you see this patient, she had a very broad forehead, and there was hair loss from the sides. So we did a transplant for her, and you can see again it was obviously done without shaving off her head, and you can see the regrowth of hair, and it looks really good and thick and amazing. She had good donor area. Now there is another pattern of hair loss where we see that the hairline is little receded. So such patients, when they comb their hair down, it looks covered, but when they comb it up, they are unable to style their hair because it becomes too broad, as you can see in this patient. So we did a transplant, and it was done obviously without shaving off her head. You can see some early growth. She was easily managing, like she didn't have to hide her scalp, and as you can see, early growth, it's looking good, and then these hair keep on growing. Another interesting case I would like to show you here is a case of a transgender patient. So a lot of patients these days, they get their sex changed, and from male to female. So this patient also came to us with this problem of hairline. The hairline didn't look feminine at all. So we created a feminine hairline for her, and if you see this, the result, if you see, it looks very good, nice, and it looks like as if nothing has been done, and it looks so natural. So creating a hairline, feminine hairline, is also an art, and it is more tricky than creating hairlines in males, because there are different shapes of forehead in females which we see, hairlines very different and little difficult, and most doctors are so used to do transplants in male patients, and obviously the number of female patients going for transplant is less. So sometimes lack of experience can distort the things. So as you can see in this patient, she had got a transplant done somewhere else. She had thinning in this portion. A little bit of work was done on the hairline as well, but it doesn't look good. There is lack of density. The shape is also not natural. So she came to me for a repair job, and we did exactly that. We reshaped the hairline. We made it look less unnatural and more dense. As you can see the results, and obviously the surgery was done without shaving off her head. And so hair transplant in female especially is little tricky, and you should do your research before you uh, choose a clinic or a particular doctor, what kind of experience the doctor has and what kind of results they have been delivering. Now, that was about natural hair transplant. There are, as I've told you, there are two different methods, FUT and FUE. So just in case you don't know details of the procedures, I have made enough videos which are there on the YouTube channel. Please go through the videos. They have abundance of information about FUT and FUE, what are their pros and what are the cons. Everything is given there in detail. Now, suppose if you don't have enough donor, then what do we do? In case of paucity of donor in a female patient, which can be possible in a lot of female patients, there is another technique called synthetic hair implant. So these are artificial hair. We don't have to be dependent on the donor. Uh, these hair come in different lengths, 15 centimeter, 30 centimeter, 45 centimeter. You don't actually have to wait for hair to grow. Sometimes when there is emergency, marriage or something like that, you can solve that problem. The pros and cons of this treatment I have discussed in detail in different videos. The links have been given. You go through the channel, you'll find a lot of videos on synthetic hair implant which I have made. So let me show you one of the cases. This girl was getting married, and she had big middle baldness, and she didn't have time as well as donor. Her donor was also deficient. So we did synthetic hair implants, and if you see now, it looks pretty good, and everything went good. Then there is another technique called scalp micropigmentation, where we create small dots, tattoos, which camouflages the area and it looks more full. So as you can see in this patient, we did this, and the thinning zones, they look better. So sometimes we have to choose a combination technique depending upon the case. So in many patients I do natural hair transplant, then just to add on density, we do this scalp micropigmentation, plus at the top, to top up, we can do synthetic hair implants. So baldness, I know, is a major concern for everybody. Nobody wants to go bald, and especially when it happens to a female, it becomes a very socially embarrassing issue for a female. Now, because to an extent, hair loss is still acceptable in males, but in females, um, it becomes big torture. So those people, those females who have faced this problem, who are facing this problem rather, they you don't have to worry. The solution is right here. There are so many different treatments. All you have to do is consult a good hair transplant surgeon, or before that, in fact, consult a good dermatologist, and try to understand all your different options. You don't have to struggle with this problem for the entire life, because solution is easy. So sometimes when you lose track, you lose confidence because of this hair loss issue, just take time out, and just divert your attention towards something else. A good option is meditation. So if you meditate, if you do some positive affirmations, that is really going to help you, and not only in your life, also it will help you to find a more effective solution for your problem. I have a separate channel where I put guided meditations, affirmations, positive music. The link is given. Please go through that channel. It has got some amazing stuff. So if you like the content of video, please press like button and do share it with your friends who might need it. And if you haven't already subscribed my channel, please subscribe it right now, and don't forget to press the bell icon. You can also follow me on Facebook, Instagram, Twitter, and thank you very much for watching the video till end. I'm so grateful. Thank you. Love yourself. Stay blessed.